Hello, welcome, welcome. I see everyone starting to come in. Good morning. My name is Xiomara Ellis. I just wanted to give everybody a warm welcome this morning. Hope everybody had their coffee, their tea, their water. We're up and ready for the day. Hi, I would just like to welcome everyone to today's advocacy webinar being held by Voices for Prevention. Good morning. Good morning. Oh, I see some people coming in. Great, great, great. All right. So, this beautiful Friday morning, I wanted to welcome everyone here today to the advocacy webinar for beginners held by Voices for Prevention for suicide prevention advocacy and substance abuse prevention advocacy. So I'm really excited for all things today. Good morning. I see you in the chat there. Good morning. Good morning. I would like to ask for all those who are not speaking today, which would be our wonderful speakers, I would like you to keep your mics on mute until you are asked any questions or asked to participate throughout the presentation. But I just thank you. Good morning. Good morning. I see everyone coming in the chat. Well, once again, my name is Xiomara Ellis. I work here with Voices for Prevention, and I wanted to say thank you, everyone, for joining us and registering for this great webinar. I'm really excited for all the information we're going to relay to you today. And I just want to say good morning one more time. So let's go to the next slide. So once again, this webinar is being held by Voices for Prevention, and this is just some of our team here presented. We have Dr. Gregg, and we also have Esther Lopez. I hope she's here. If she's not, I understand, but she is the project director with Voices for Prevention. Does a lot of great work with Voices. I work directly under her. I'm her assistant project manager, and we also have the awesome Marcio, who's here with us. Would you like to say hello to everyone?
Absolutely. Good morning, everybody. Thank you for being here. I just want to tell you guys
Thank you. And
something
he is
this
our ears,
morning.
eyes, fingers.
Uh, this month is Suicide Prevention Month, and we've been doing a campaign on our social media accounts, Instagram, Facebook, and Twitter. I encourage everybody to follow us, to like and engage with all these posts. It has been an amazing content that we're posting daily for the month of September with the amazing help of Xiomara with the content. Please go to our social media accounts, like, share, engage with us because it helps the algorithm for us to even further promote those messages. So Instagram, Facebook, and Twitter at V4PGA. And thank you for being here. It's a pleasure.
Thank you, Marcio. And he is definitely right. I'm really excited about all the work and the various activities we've been doing. Just yesterday, we had a movie screening. So if you are not already, please definitely, I encourage you to follow us. So next slide, please. Thank you. So now I come to the meat and gravy of the potato of the meal here. I wanted to give a warm welcome to our presenters today. Well, today we have presenting Gregg Raduka. He has a Ph.D., LPC, ICPS, and is the Director of Prevention Intervention Division of the Council on Alcohol and Drugs. The evidence-based suicide substance abuse prevention programs he designed and implemented have served thousands of Georgia's parents and children since 1987. These programs, rigorously evaluated by several Georgia universities, have won 7 national awards from the United States Department of Health and Human Services. He has also worked closely on advocacy issues with Georgia General Assembly for the past 6 years, and has also worked on advocacy related to the city ordinances. He received his PhD in Human Development from the University of Maryland's Institute for Child Study Department of Human Development, is a licensed professional counselor and internationally, I do apologize, internationally certified prevention specialist. He is the founder and was the first president of the Prevention Credentialing Consortium of Georgia, which is PCCG. We also have Shannon Lawson, which I'm really excited about as well. Shannon has been active in the community level change work for over 20 years. She currently works for the Council on Alcohol and Drugs and is the project director of the Upson Gen RX project, serving the Upson County City of Thompsonton community. Shannon earned her Bachelor of Arts degree in education from the University of North Georgia. She went on to serve the communities of Hall and Troup County as a special needs educator for 10 years, and then transitioned to family engagement work for the Troup County school system for another 10 years. Shannon then took her love for community beyond the school walls when she joined a local substance abuse prevention coalition as its project coordinator, and immediately was intrigued and engaged and energized for the task at hand, for helping to improve the health of the community in which she lived, worked, and raised her family. As she celebrates her 1-year anniversary with the council, her level of commitment to health and substance abuse free communities across Georgia is only reinforced by the council leadership as we find ways to provide prevention services across our great state to ensure health future for all Georgians. I would like to give a warm welcome to Dr. Gregg Raduka and Shannon Lawson.
All right. Well, thank you so much, Xiomara. It's really been an honor to work with Esther and Xiomara and Marcio. They just do an incredible job with Voices for Prevention, and just so privileged to be working with them. Want to welcome everybody today. Thank you so much for taking time out of your busy schedule to join us. I do feel it will be well worth your while, and worth a while of adults and children all throughout Georgia if this webinar results in more action in the advocacy area by such dedicated and knowledgeable professionals as I know so many of you are. There are a few I don't know, but the people I know are just great people to work with and so dedicated to what they're doing. Want to thank DBHDD, OBHPFG so much for all they do. They are so skilled and knowledgeable about what they do and provide such great guidance for programs like Voices for Prevention. Want to thank in particular Jill Mays, Donna Dent, Nakia Green Young for their very hard work and all their help in making this possible in the first place. So today you can see our webinar overview, and we're going to look at the what, why, and how of advocacy. This is for beginners, but those with some experience, I think, will find the webinar a great refresher. And you may also discover new material that you didn't know before, and hopefully will. Part 2 is going to be done by Shannon, and it's about empowering young people to how to advocate. Part 3, resources and references that you can use, very practical resources and references. I think it's a great list regarding both adult advocacy and the whole world of youth advocacy, which is much bigger than I had realized previously to my Voices for Prevention work. We're going to finish up naturally with a call to action, since this is an advocacy webinar. And although we'll be definitely focusing on substance abuse and suicide prevention advocacy, if there are other related topics concerning behavioral health issues, I think you'll find that this information is so general that it can be used for issues that are related to substance abuse and suicide as well. So there are our learning objectives. Some of those I've already mentioned in the different parts of our webinar. I think you'll be able to describe all these things by the end of the webinar. And by the way, we are going to be posting this on our V4P website. So I want you to know that the slides will be posted there, should be probably sometime next week. So you can be looking out for those as well. We are going to be issuing prevention certificates for the 1.25 hours of the webinar. We do look at how long each person has stayed on the webinar. And so we don't want to give a certificate to somebody who may have joined us just for 10 minutes. So you would need to stay for the majority of the webinar, and we will give you the information about how you can request a certificate at the end of the webinar. Here are some additional learning objectives that Shannon will be covering. Some of you are familiar with the Dover Youth to Youth Empowerment Model, or Dover Youth to Youth in general, just an incredible advocacy organization that was highly recommended to me some years back by Dr. David Jernigan with Boston University, who presented at our Substance Abuse Prevention Day last February. So I want to say that DBHDD has just approved a new beginner's advocacy toolkit for adults and youth, and very excited about this. Most of the information that we'll be presenting to you today is going to be available in the advocacy toolkit, and that should be posted by the end of the month, again, on our V4P website. And you can see the address for our V4P website on the cover of the advocacy toolkit. So part one of our presentation is advocacy: what, why, and how. What is advocacy? Broad term, covering a range of activities, but it's mainly bringing about change. So it means getting off the couch, really doing something about a problem that bugs you. That's, I know that's not said very formally, but I think sometimes the informal language is better for me in really getting to the point. You may not be funded to do advocacy, but I hope that it's something you will pursue, whether you may be funded to do it or not per se. And then bringing about changes you want to see in laws and policies. The advocacy work that I've done, especially in the last 6 years, I feel has been some of the most important and very meaningful work that I've done throughout my career. It just feels like you're being the change, as has been said by others. So if you want to see changes in state, county, or city laws, depending upon what kind of geography you want to choose to work in, it may affect your county or city school system, your parks, your workplaces, and other locations as well. Just for semantic purposes, ordinances are local laws, really mean the same thing as laws, but cities and counties refer to their laws as ordinances. So some of you have heard this before, but some of you have not. And so if you have heard this before, please bear with me and consider it a refresher, if you will. But two basic kinds of advocacy: policy education and lobbying. And these are the semantics that we're going to be using, and I've used these semantics for the last 6 years. So if, at least for purposes of our webinar, I'm going to be using these terms. So policy education refers to educating various kinds of lawmakers and the public about the problem you are concerned about and the changes you or your organization want to see take place. And you can educate your policymakers and the public about various aspects of your problem. Why this problem is so crucial and needs to be solved and solved now or in the near future. You can let your policymakers know about effective solutions that are out there so you or they don't have to feel like they need to reinvent the wheel. You can also let them know what hasn't worked. You might see something in a pending bill or legislative or ordinance that you know the research has said, you know, this doesn't really work. And the lawmakers are not going to know this unless you tell them. So that education is real important. What works, what doesn't work. And then the particular solutions that you're interested in seeing happen in your state, in our state, in your county, in your city. And then there's a second kind of advocacy that's called lobbying, which is different than policy education. It's an attempt to get a policymaker or the public to vote yes or no on a bill or ordinance. And a bill is a piece of legislation being considered by state or federal legislators. If it passes, then it becomes a law. So there are two kinds of lobbying. Direct lobbying, where you are telling your policymaker how to vote on bill number 356 or ordinance number 22. Grassroots lobbying is a little more indirect. It's telling your organization's members, your team members, or the general public to contact the policymaker to tell them to vote yes on Bill 352 or Ordinance 26. So those are the two kinds of lobbying. What kind of advocacy is best for your team, for your organization? And you have to be a little careful here, because if you work or volunteer for a nonprofit that receives funding from federal, state, or local government, then your organization does not receive private funding. Or if you work for a government agency, then you really shouldn't try lobbying, because you can't use government funds to lobby. Now, you can use government funds to provide education, and there's so much that can be done in the area of educating policymakers, excuse me, as I referred to in a prior slide. You can lobby, but only when you use private funding to do so. And you can't lobby in the name of a government funded project or program. But it is your First Amendment right, free speech, for you to lobby as an individual. But there are some caveats here that you just have to be careful about. To lobby on your own time, you know, take a leave day, take some vacation time if you want to go down to the Capitol or go to your city council or county commission to lobby, not when you're on the clock. And use your personal email address, personal street address when communicating with policymakers, and don't say that you're a representative of such and such an organization if that organization doesn't have the private funds to allow for lobbying. If you're a government employee, this is even more crucial, and government employees should take the extra step of checking with their supervisor even before attempting to lobby as an individual. And also, you know, I'm not an attorney, I'm not a lawyer. If you get into the weeds on this and you have certain questions about your specific circumstances, your specific organizations, to be on the safe side, you may well want to contact a knowledgeable attorney who's familiar with the laws that concern lobbying. So this is a real important slide. Why should we advocate? I think just about 99.9% of us in these fields of substance abuse prevention, suicide prevention, are very familiar with the incredible suffering that's caused by these issues. And we're talking about intense human suffering, children, families torn apart by these things. So my work in treatment centers in earlier years certainly brought home to me how many tears I saw, how many broken relationships, these are tough problems. And again, hat is off to all of you working in these vital areas in order to relieve human suffering, to reduce human suffering. And if you can prevent it in the first place, wow, what an accomplishment that is. And I know so many of you are doing that and have done that for years. So advocacy is a way to make a difference in order to reduce this kind of suffering by educating policymakers and the public about laws and programs that need to be in place. What should we educate about? And this is largely up to you, what your particular issue may be, because there, as you know, there are so many issues to educate policymakers about when we talk about the huge fields of substance abuse and suicide. So you want to educate about the laws and programs that you know prevent this kind of suffering. So in order to do that really well, you need to first find out what your community needs are in your particular area of substance abuse or suicide, what the statewide needs are, depending again on the geography you want to try to affect. So you need to answer some questions, and you need to be realistic when asking those questions. What do you want to focus on? What should you focus on? You focus on your city, your county, your state, two of those three, all of the above, just one. And has a needs assessment or survey or surveys been done that can tell you what the major unmet needs are in your city, county, or state? That's an important piece, because when you get with policymakers, you want to be able to say that you have based what you're telling them about on some of the science, on statistics, and you're not just talking out of the top of your hat. So what do those needs assessment or survey results tell you? In which needs can you really make an impact on? So who should we educate? And again, it depends on the jurisdiction, and the jurisdiction is a legal term, and you can see the 4 kinds of jurisdictions we're speaking about in this webinar. I haven't mentioned the federal jurisdiction of the United States, but from time to time, these issues do come up in the United States Congress, in either the Senate or the House, and you may well want to educate a federal legislator. If you've been to Category conferences and gone through their incredible Capitol Day, I think they call it, and visited with some of your federal lawmakers, it's really quite an experience. If you haven't done that, once the COVID restrictions are lifted, I highly recommend the leadership conference. I think it's in each February of each year, where you can visit your federal lawmakers or their staff persons. But for a city or town, it's the city council. Depending upon the city government, it could be a mayor, a city manager, or similar title. Counties have county commissions and a commission chair. Again, the titles might vary a little, but that's the basic setup for counties. In states, you've got the Georgia General Assembly, which is the parallel to the United States Congress, and you've got your state senator and your state representative. You've got also in the Congress, US Congress, you've got 1 senator, 1 representative. In the United States House of Representatives, instead of being called representatives, they're called congressmen or congresswomen. So I would guess that many of us don't know who our state senator is and who our state representative might be, and that's fine. But if you don't know, there's a very, very easy way to find out, and that is by going to the openstates.org website. It's an incredibly easy website to use. And just by filling in your home address, you can find out who your state senator, state representative, US congressman, US senator are within a couple of minutes. So this is very important if you don't know who your state senator, who your state representative is, to find that out. And also, I think their picture appears on that website as well. If it doesn't, try and Google for your senator or representative so you know what they look like when it comes to Substance Abuse Prevention Day, which we'll be talking about a little later in the webinar. School systems and workplaces are additional locations that you may be interested in changing policy and educating school systems and workplaces about what may be better evidence-based policies and procedures that they simply might not be aware of when it comes to substance abuse or suicide prevention. And you may think of other locations. These are two that came to my mind. Juvenile courts may be another location where you may want to impact policies and procedures. School superintendents, boards of education, PTSAs, all good to impact. Workplaces, you might want to go to your local chamber of commerce. Community representatives are a good place to start, especially with the larger companies where the CEO is incredibly busy, and company boards of directors may not be the best place to start either, especially with the larger companies. So community representatives, probably the best place to start if it's a larger company and they have a community representative. Those representatives are the liaison between the community and the company. It's important to educate partners. You don't want to try and do this on your own unless you're super good or you're a very comprehensive organization or team or agency. It's really good to have partners for moral support, if nothing else. Can you imagine the first tobacco preventionists when they started? People must have thought they were absolutely crazy, think they could impact tobacco use in this country. And so it needed a lot of folks, a lot of different organizations getting together to make an impact, which they did incredibly successfully. Still have the problem, but it's so much better than it used to be. So, identify who the best partners for your organization or youth action team might be. And we can complement each other with our expertise, but also give each other moral support, which in even policy education can be an uphill battle sometimes. You may not be able to get an appointment with your senator or representative, but you may be linked with an organization that has a little more clout than yours or your team does, and maybe that organization can help get a meeting for you with both of you and your policymaker. And some organizations have more experience than others, and in our field, people share so much what they've learned over the years. So if you're a less experienced agency, you could team with an agency that has a little more experience. You also want to educate at times the general public, depending upon the kind of need that you have in mind. Sometimes it'll just be policymakers, but most often you want to educate the general public as well to get some support, or if not the general public, then a sector of the public that is being affected by the issue that you're addressing and will benefit from a change in policy if you educate the policymakers about the issue. So it's important to know how we should educate as well. What are policy education strategies, what your organization or team can do. And our advocacy toolkit goes into each of these policy strategies with a lot of depth. And so you can find out more once that toolkit will be available on our website. And of course, there's no cost for that toolkit. Finding out the facts. Again, you've got to know the facts, because if a legislator or a county commissioner does ask you some questions, you do want to be prepared. You don't have to know everything about your issue. You know, rarely does anyone know everything about the issue that they're trying to educate about. But if you can find out major facts, that's important. Know your audience. Find out some things about your mayor. Find out some things about your city council members. You might want to find out if there's a city council member that might work for a nonprofit themselves. If they're in human services and their day job, as you might say, that could be a good place to start with the city council. And they might give you an entree to other city council members and to the city manager. Personal stories are so important. Policymakers, stats are important, facts are important, but personal stories are facts that can really hit home. And I've heard it said that one personal story can be worth 1,000 statistics. So if you know a personal story about substance abuse or suicide, it's important to share these stories with policymakers. And I don't have it on my list here, but it's so important if you can also involve youth. And Shannon is going to be speaking to that in part 2 of our webinar in a little while. So I'll leave that to her. And some of you have involved youth wonderfully well in prior substance abuse prevention days. So thank you so much for doing that, because you just see the legislators' eyes open up when they're talking with young people. Elevator speech is real important. You know, the saying is, what speech could you complete on an elevator ride from the 1st to the 5th floor should you happen to be in an elevator with a policymaker? Many times they are so busy, that's all you may have time for. That's all they may have time for. And so if you have a magic moment where you get on an elevator with for example, with a very important policymaker, you want to be prepared, or you want to have that speech memorized to let them know the most important points that you want to educate them about concerning your issue. Talking points is a printed version of the elevator speech. You can create a one-pager of discussion points, the points that you want to drive home that you feel it's most important to present in order to educate that policymaker. Policymakers, especially state senators, state representatives, get so much paper, and they're dealing with 300 bills at the same time. It's mind-boggling. So 1-2 pages with some really good graphics, colorful graphics. It's kind of like the two-dimensional version of the personal story. You want to make that one pager look as attractive as possible and get the most important facts for the legislator to know on those 1 or 2 pages. There are traditional strategies that are covered in the toolkit. There are also, of course, social media campaigns, incredibly important, especially for educating the public or sectors of the public. Town hall meetings are a great way to go if you want to have a panel discussion with representatives of your community, so representatives from law enforcement, representatives, a politician from the city, county commission, a state representative, state senator, you know, those sectors, as those of you who know with drug-free communities know so well, that need to be represented in a town hall meeting. It can be a great way to educate the public. Contacting policymakers, the best ways are in person. Of course, with COVID-19 restrictions now, you may need to meet your policymaker via Zoom, because we want everybody to be safe as they can be during this time. So Zoom meetings, highly recommended. That personal touch as much as possible, and use your videos so that your legislator can see you while you're on that Zoom meeting, because you don't want them to get possibly bored if they're just seeing slides. You also want them to see a video of you. And face-to-face meetings, again, with the COVID-19 caveat, once those are more possible, if those are possible with masks and social distancing, those first two are the best. This list is kind of a rank ordering from most impactful to probably least impactful. Phone calls are great, not as good as face-to-face meetings, but if you can get your policymaker on the phone, wonderful. You may only be able to get their senior staff person and maybe leave a message, ask your policymaker to call you back. It's very important to let whoever answers the phone know that you're a constituent of that policymaker. In other words, you live in their district. And it doesn't matter if you're a youth who can't vote or if you're an adult who can vote. Again, legislators are paying more and more attention to youth. And so it's real important to let them know that you live in their district. Letters, there's a caveat with letters. Typically, they're less effective than those modalities above. But if a policymaker gets 20 letters, maybe even 15 if they're local, they're going to pay attention to those letters, even 20 or 30, even on the state level. So letters can be really good if you can get a good volume of them presenting, and it's very important that those letters present the same educational messaging and not contradictory or different kinds of messages. Emails, and I know, you know, time in 2020 is so precious that all you may have time for is an email. And some organizations have automatic emails. Some of those organizations are lobbying organizations, but emails can be a good way to go, especially if you don't have time for these other modalities. It's much more important to email than to not do anything at all in terms of education. One great way is how to do policy education. Please, if we're able to have a physical in-person Substance Abuse Prevention Day, we hope you will come to Atlanta on March 9th from 10 to 2 o'clock. There's a picture from our last Substance Abuse Prevention Day with a resolution from the governor honoring the day. So we very much hope you can join us for that. And it's a time to visit with your legislators to educate them about substance abuse and suicide prevention issues. Tips for communicating with legislators: mainly, don't be intimidated, don't be scared. I think so many of us feel that prevention is just not as impressive as treatment for some reason. And please don't feel that way. You know, again, treatment is incredibly important, but gosh, if we can reduce or prevent this suffering before it starts, you know, how incredibly wonderful is that? So what you do is incredibly important. Prevention is a scientific field these days that needs to be respected both by us in the field and by policymakers. And the more you share about substance abuse prevention and suicide prevention, the more these legislators are going to get the idea that, hey, these folks really know what they're talking about. So please don't be intimidated. I think that blocks more of us from advocacy probably than any other obstacle. You're going to know a whole lot more about these issues than 99.9% of your legislators. So you're going to be the expert, especially relative to your policymaker, even though if you don't feel like you're an expert yourself, relative to them, you are. Again, one legislator said that his knowledge about issues was 10 miles long, but a foot deep. So please keep that in mind, and you can deepen that river by presenting him with the facts, or presenting her with the facts. And so at this point, I'm going to stop sharing my screen, and I'm going to turn it over to Shannon Lawson.
Thank you, Dr. Gregg. That was awesome. Great segue into the next section, which is we're going to be focusing on youth advocacy and the importance of youth voice. I am Shannon Lawson with the council. It's so good to see everyone on the screen. I miss my friends. I miss getting together in person, but I want you to know I put makeup on today, mascara and perfume just for the meeting. So I'm so excited to be here and to share a little bit of knowledge and a little bit of information that I have gleaned in my quick, fast 5 years as a preventionist in the field. So before we get started with my part of the slideshow, I wanted to just pose some questions. And at the bottom of your Zoom, you have a reactions button. And the reactions button for me, I can either applaud or give a thumbs up. So I'm going to ask some questions, and if you're in the affirmative of that question, or if you can answer yes, I'd love for you to see some thumbs up across the screen. So are we cool with that? All right. So raise your hand, your virtual hand, or I guess you could raise your real hand. If you serve currently as an adult advisor to maybe a youth action team or a youth group in your purvey, are you currently an adult advisor to some youth? Anyone? I see Mr. Harry with his thumbs up. Or some more thumbs. Anybody? Anybody? Oh, maybe I just can't see. Oh, I see. I see a feet. Oh, there we go. Awesome. This is exciting. Okay. Next question. Raise your hand if you are over a statewide action team, a youth action team that is a part of oh shoot. God, thank you. Youth action team, statewide action team. We got any statewide action team adult advisors on the call? Maybe a few, and I can't see everyone. Thank you for participating. What about if you are a project coordinator or a part of a coalition or a work group that has to have sectors from your community represented, and youth should be a part of your coalition work? Any thumbs there? In fact, I'm going to raise mine. Or raise my thumb, raise my hand. I'm changing the, perfect. What in your professional world, do you work with children or youth at a school, maybe an after school program or a community center? Any thumbs there? Now, throwing off that professional hat, I see your thumbs. I see Allie, I see your thumb. I'm going to put on my personal hat. Do you have any youth that you are around maybe as a volunteer, maybe at your church, your local worship center, or a community partnership that you may work with? You have any youth that you surround yourself with there? I certainly do. I'm going to thumbs up that. And then family and friends. Any teenagers in the houses of family and friends, or maybe even in your own home? I have one more teenager left in my house. He doesn't even live here anymore, but he's under my familial rule. He will be 20 next month. I just thought about that this morning. And then finally, do you live in a town or city or a community where youth reside? Are there young people in your area? There's some thumbs. Everybody, thumbs all around. Awesome, awesome, awesome. I just wanted to take this moment. Thank you for participating. Just take this moment to say that we have youth all around us. And the work that many of us on this call are tasked to do has to do with substance abuse prevention or suicide prevention, and with the focus on youth use and preventing that. So it's so important that while we're doing this work, that we're talking and incorporating and activating that youth voice. And I'm going to start sharing my screen. Let's see. Sorry, guys. Hold on one second. So what better, when we're talking about youth voice, what better way to grab a quote from a past, older, deceased president that is not in any of our time zones. But anyway, it's a good quote and I liked it. FDR once said, "We cannot always build the future for our youth, but we can build our youth for the future." And that really spoke to me. You know, so much of our work is implementing or working to help youth, and oftentimes youth are never even in the room. Pardon the Hamilton reference. You know, they want to be in the room where it happens, and we oftentimes find ourselves not able to even invite them into the room, quote unquote, or to invite them into the conversation or to engage them in the work. And it's so vital. And I like this quote, how it says, if we build our youth, but we can build our youth for the future. So important, so important. I love that. Thank you, FDR. My hat's off to you, sir. Well, that didn't come through. Oh, there we go. So we did our raise the hand part, but now in the chat box, if you will go to your chat and just type, I want to pose a phrase, two-word phrase, youth voice. What does those two words mean to you? And it could conjure up positive feelings. When giving youth a time to have a voice, it could conjure up all kinds of great, awesome words and feelings. And then it could make you worry. There may be some worry there. There might be some even, I hedge to say, some negative feelings, but we want to hear from that. Just shoot in the chat, what are some words that you might use to describe youth voice? Oh, I see empowerment. Awesome. Energy. I like that, Mr. Harry. Miss Linda, that's good. I'm going to speak to that in a minute. Changing. Youth voice is changing. Thank you, William. Knowledge. Miss Mona says voice. Yes. Heard, John Bringell. Great. The next generation, absolutely. And I would even pose at this generation. A fresh perspective, absolutely, to the work we're doing. Dustin says giving children a chance to express their point of view without judgment. Nice. Fearless. What about, anyone have some feelings about when you lend youth voice? Thank you, Mr. Ron. Their reality. That's absolutely true. Their voice is their reality. Is there any negative or worry when we give a youth the quote unquote, the microphone? Certainly there is. Thank you for participating in that quick little chat with a friend. And I consider us all friends on the call. And also the raising your hand activity. I appreciate that. Oh, there was a few more that came in. Let's see. Perspective. Thank you, Afia. Yes. Yeah, that we won't like what they had to say, Dustin. Absolutely. There may be some things said with their voice that we might not like or might not, in the old term, G-haul with what we, need to have happen. It might disrupt our norms. You're right, Lindsay. They're sometimes fearless in speaking their mind. Absolutely. And that's powerful and scary all at the same time, right? Thank you so much for sharing, guys. So I just want to say that when we engage in youth voice or youth empowerment, when we are empowering our youth to become advocates, to find their voice and to be able to speak what they need to say, it's kind of a 1-2 punch. Empowering the youth voice promises impact on 2 levels. So we're going to certainly impact our community when we're giving that youth voice a audience that a group of youth might have as they take action to reduce substance abuse, either in underage drinking, tobacco, or even in the area of teen suicide and the prevention of that. And then that 1-2 punch, that second effect, the effect on participating youth advocates has on for themselves. Youth participating in these programs generally become informed. They're going to develop skills, and they're going to become very committed to practicing what they preach. So it's a 1-2 punch when we're giving this empowerment to the youth. Now, when our youth voices, when their voice, is heard, megaphone, we know its power. We saw that in the chat with the great things you shared. And we know it's a gift. When we have that knowledge and their expertise and their voice, it's a gift to us in the work we do. It informs the work we do, and it allows us to go out in the world and know what we're doing is working, and we're helping specifically what they need. And then, we know we need to build a space for it. We need to build a space for those voices to be heard. But how do we do that? The age-old question. How do we allow youth voice and young people to be advocates for their own issues and for the issues that we're all working on? So one reason, one method, and Dr. Raduka spoke of it earlier, the Dover Prevention Group, the Youth to Youth, Dover Youth to Youth, let me say their name correctly, in Dover, New Hampshire. They've been doing prevention, after school programming and prevention work for over 20 years. And like Dr. Raduka said, they kept their particular One Voice Youth to Youth empowerment strategies or method or model that they have produced for their own group and now have produced for public consumption is just really powerful, the way they are training their youth to be advocates. And this screen just shows you kind of their workflow for their model. I believe some of us in Georgia, some prevention groups have invested some of our monies into their model and are using that to train our youth advocates to be better skilled at that task. And so that is an option for you if you're in the position to do that. But they've also graciously let us look at this model here and let us glean a little bit today of these tips. So let's just break this flow chart down. The first part, I want to go back. So at the top, I'm pointing at it like you can see, I'm sorry. At the top, you see in large letters, knowledge leads to skills, leads to taking action. Very simple, 3 very simple steps. And we're going to break that down. So if we will agree that knowledge is key, and instilling that knowledge or teaching that knowledge, sharing that knowledge that we have as preventionists or as people, as adults, to our youth about consequences of use and risks of use. So that could be data, that could be what's going on in the community, sharing that with them. What are true risks and consequences? And many of us are already doing that. Also knowledge in the field of industry influences. So what is the alcohol industry's influence on our community at large, on our policymakers, and there he is, on our the influence on government in general, and the alcohol industry, marijuana industry, tobacco industry. All those industries have significant influence on how policies are written, laws are introduced, because like Dr. Gregg spoke to, not to this point, but where we are not allowed to lobby, only policy educate. I mean, they have large sums of money that they can lobby on their own interest. And we need to show the youth that influence and teach them that knowledge so that they can understand the full ramifications of what's going on. And then there's media influences, commercials, social media influences, and other things that are good to show our youth as well. Teach our youth as well, Next slide, going across, if you can remember back, going across that continuum is skills. Skill building is so important. Public speaking skills, communication skills, and giving our youth opportunities to practice these skills. It may be at youth action team meetings. It could be at planned events, virtually right now. I would assume we're all having to do virtual planned events with our youth. I would say probably my first soiree into learning how to skill build with our teens prior to my education experience, but specifically into prevention, was just immersing myself. In fact, it was probably my second week on the job. I took a group of 4 young men to GTI, Georgia Teen Institute, fabulous, fabulous, fabulous skill building week for our youth. That is put on by God here in our state. If you're looking to really have an immersion of skill training, this is not a commercial, they're not paying me, but when Georgia Teen Institute is available to you and you have access to take youth, I highly recommend it. Just that's personally my plug there. Media development skills, legislative skills. How does make an appointment, how does that process work? What does it look like to sit down with your legislator? How do you even, prior to that, look up legislation that's even being looked at? How does a bill become a law, mainly? You know, all that skill building, media literacy, problem assessment and analysis, and that's where that data comes in. And kids are so astute to numbers and are so knowledgeable on how to make the data work for conversations that they need to have. So don't be scared to talk math with kids because, well, quite frankly, they probably can do rings of math around me, but they understand that, they get it. And some kids really thrive off of knowing that information. And organizing and collaboration, all these are important skill building techniques that build upon each other. So you've got the knowledge base, it's going to build up on skill base, and then eventually your youth are going to be ready to take action, to be advocates, to have advocacy skills. And that may look like taking action by planning a community awareness activity or event, by working with some legislative action or policy change. So they may work on a media campaign about the importance of not having so many vape stores in the town. Whatever at your community level is affecting community health, behavioral health, and you want to address, there's some ways that kids can take action and plan events. And it's exciting to see them do that and have the knowledge and the skills where they're ready to take action. Educational activities and presentations, and also creating media, social media, Instagram, Twitter, all kinds of things, more than those two words. Facebook, because, you know, that's the only thing adults know. Sorry for the young people on the call. I know you know a lot more, but TikTok, and how to use those media spaces for positive change and to take action. So important. So the next slide is just it says 5 tips, but maybe I like the word takeaways better, and I should have changed it. So 5 takeaways from being able to work with youth advocates, being able to train and let loose youth advocates. The first takeaway that I like, and a tip to remember, is you want to amplify, be a cheerleader for their voice and not necessarily your voice. We talked about that earlier, and many of you spoke about that in the chat. When they speak, they're speaking from their heart when given the opportunity and a space to, and it's not what maybe they've heard us say. Sometimes it could be, or their parents say, and of course we're going to have some of that, but it's not us forcing our voice on them. We're amplifying their voices up when we're allowing them to use their voice and advocate for themselves. Also, you want to, as a tip or takeaway from this, you want to broadcast your willingness to, stop. I messed up. I was trying to move my little screen around because I can't read my tip. You want to broadcast your willingness to, someone shout out what that says behind there. Oh, fiddly dee. Shannon, technology. See this problem right here I have? Anyway,
just be a helper.
Thank you. I was going to say be a cheerleader, but I didn't think I used that word. Be a helper. Thank you, Dr. Gregg. If you see youth out taking action, you want to positively reinforce that. You broadcast, you're not shy about it. You're opening up that you have a youth advocate and look what they're doing. You are their cheerleader, as a matter of fact. You acknowledge that third takeaway or tip, you acknowledge and assume competency among your youth leadership. You are there, again, I don't know why I come back to cheerleader, but you are assuming they are very competent. Their leadership shining through when they are advocating for things, and you acknowledge that. But then number 4, don't assume anything else. Don't assume that they always are going to know everything. There's going to be skill building along the way, knowledge building along the way that you're going to need to provide. And then you might come to an instance and say, oh, we need to go back and circle around and make sure we're good in this area. Don't always assume that they understand social cues or just adult things. Don't always assume that. Sometimes they're going to. Sometimes they may just they may need help walking that through. And then finally, be realistic about possible outcomes. And this is so important. Youth want to feel like they're being led by truth and not by gotcha. So here we have kids, they're going to have knowledge, they're going to have skills, and they're going to go take action. And we all know in this field that sometimes we are advocating and wanting for change, and our lawmakers to make our community members empowered to make change for the positive. And sometimes that doesn't happen for whatever reason. Sometimes our outcomes are positive and good, and sometimes they're not. And being real and open to that and being realistic is so powerful, and youth can see that through us. And I just would really say a takeaway is to be as realistic about the outcomes as possible. And finally, I have a little excerpt from a beautiful write-up. Madison Foster is a youth coalition member of Drug Free Fayette. Shout out Drug Free Fayette. I know Michael's on the call. One of their adult leaders in Fayetteville, Georgia. She's a junior at Fayette County High School, and she and many of her team participated in Substance Abuse Prevention Day. And you guys, we had a fantastic showing of youth at the Capitol this year. Awesome. If you brought kids, kudos to you, because I know that's an undertaking. But just to show you how powerful youth voice is in action, I took a little excerpt from her full letter that's published in the toolkit Dr. Gregg spoke of in Appendix 3. And then I'm going to, let's see here. I'm going to have that same issue with the box, but here, I'll read it. Talking to the state legislators, this is her words, felt satisfying and fulfilling. Anybody can talk about wanting to make a difference or, oh, fiddly dee. Hold on. Let me see if I can move y'all. Oh, look at there. Look at there. To make a difference, or anyone can say they want to see a change. Actually taking action and doing something about the problems I see made me feel empowered. Though I was a little nervous speaking, I knew that what I was saying mattered and that these were the steps I had to take to ensure that change would be made. We spoke to State Representatives Josh Bonner and Derek Jackson, and it was reassuring to hear that they were working on bills to lower teen access to vaping. Awesome. I just love hearing youth perspective on things. And then this is powerful to see they take action and her feelings and her thoughts after it happened. So without further ado, I'm going to swing it back to Dr. Gregg, I believe.
Right.
Yes. And just so you know, guys, I'm watching the chat. I've jotted down some questions. If we have time at the end, we'll circle back. And if not, we will reach out personally and get those answered for you. Okay. Thank you, guys.
Thanks so much, Shannon. Okay, with this next part, we're going to talk about resources and references. And I'll probably go through this a little quickly, but please know that these resources and references will be available to you. And for some reason, my screen is not moving. Okay, oh, there it goes. Okay, so there are some references that I used when composing the Beginner's Advocacy Toolkit. And that toolkit is for adults and youth. There's a section that's written directly for youth themselves, as well as sections that are other sections written for adults. But there's just an amazing variety of resources out there for you. I was told about the, there's the Boys and Girls Clubs of America, there's the 84 movement, that Juan and Marco Borrego spoke to me about, and more about them in a bit. And there's Madison Foster's article that you can see her entire article on our Voices for Prevention newsletter. And I want to thank Michael Mumford so much for making that possible and facilitating that process of getting Madison's articles and pictures. The Georgia Teen Institute, Michael Davis and others, just an incredible resource. I've taken kids to the Georgia Teen Institute now, wonderful experience, and the kids thought it was wonderful. They won a couple of their awards while I was there, even better. But teaching teens the skills that they knew they will be able to use in advocacy, as Shannon was saying. Campaign for Tobacco-Free Kids, the National Youth Ambassadors Program. And by the way, if you would like your agency or organization listed in our resources, because this is by no means a complete list, there are so many out there that are doing great work in Georgia. Please let me know how to reference your organization, and I can include it in this reference list. PACE is a great one. That is a great website. They have a toolkit for youth leaders, a teen prep guide from Guide that they supplied for our Substance Abuse Prevention Day that's on Guide's website, as well as our V4P website. Dover Youth to Youth, I just can't say enough about them. I've ordered their Youth Empowerment Toolkit that Charlotte Spell told me about. It's an incredible toolkit. There's a cost to it, a fairly large cost, but to me, I think it was worth it. I know it was worth it. Just an amazing resource for empowering youth in the area of advocacy. Organizations, coalitions that can help. American Foundation on Suicide Prevention. Again, those of you, especially in the suicide prevention field, who know of additional resources, please let me know about those. My email address is graduka@livedrugfree.org. And maybe, Shannon, if you could put that in the chat box, if people want to reach me about something, not just about these references and resources, but about issues in general related to the webinar, please email me. There's a Georgia chapter of the foundation, and I attended their Suicide Prevention Day, which they will have again in 2021 if COVID restrictions are lifted. And they just did a fantastic job with Suicide Prevention Day last year. CATCA, a lot of you have attended their conferences. Amazing policy education concerning substance abuse prevention. The Council on Alcohol and Drugs, Campaign for Tobacco-Free Kids. There's Dover Youth to Youth website where you can see their toolkit and all the table of contents of their toolkit. Michael's Drug-Free Fayette is there as well. More organizations, of course, DBHDD, OBHP, an incredible entity, an incredible governmental agency. The Georgia Prescription Drug Abuse Collaborative with John Bringell, who many of you know, many of you have attended those meetings, now being held via the Zoom format. So his meetings just get better and better as time goes by. If you can attend those, if you want to attend them and are not on that email list, let me know, and I can get you included in the collaborative's email list. John sends out wonderful emails. Guide, as we've spoken about several times now, tremendous resource. Vincent Vandergrift's Heart to Heart Coalition and Learn to Grow for tobacco prevention. Let's Be Clear Georgia, that I'm associated with regarding marijuana abuse prevention education. Sue Rushi with National Families in Action. an amazing marijuanareport.org website with substance abuse in general. And these are the Borrego brothers that I mentioned before. They helped us out with Substance Abuse Prevention Day, speaking at the Capitol. And this is an incredible example of what youth can put together. Juan and his brother Marco put together a statewide vaping attention to prevention organization when I think they were juniors in high school, and now they're seniors. And then, of course, Voices for Prevention itself, and there's our website. And we will make all these electronically available to you in the toolkit, so you can just click on all these links and find out more about what these agencies are all about. So, being a good advocacy organization, we want to end with a call to action. We hope that you will become a V4P member. That will help not only Voices Prevention, but it will help you in being more informed about what's going on around our state. Also, it's very much of a two-way street. If there's something that your organization is doing, especially advocacy-wise, that you want to let others know about, so much wonderful activity, please let us know. If you can include a picture or two, even better. And that's the kind of thing we want to feature on our website. But you'll be able to receive emails on a regular basis from V4P regarding very important advocacy events, legislative updates. We've got a great newsletter that Marcio formats beautifully. And if you want an article in that newsletter, again, please use my email address in the chat box and send me an article, because we've got another issue coming up very soon. So with that, I'm going to turn it back over to Xiomara.
Thank you. I greatly appreciated Dr. Gregg. So I'm going to be going over the social media within V4P today and some upcoming events that we have to share pretty much. So let me pull this up here. Sorry about the delay.
And I'm sorry, Xiomara, I lost the slide that I should.
It's okay.
You want me to, I can go back to screen sharing possibly.
Well, while we're pulling up the slide, I definitely wanted to say that V4P is currently on 3 major platforms. We're on Twitter, we're on Facebook, as well as Instagram. And as mentioned previously with Marcio, this month, because it is Suicide Prevention Month, V4P is doing an all-month campaign where every week we're actually selecting a theme that has to do with suicide prevention. So for example, the first week in September, we did prevention through self-care. And every day within that week, we focused on a specific type of self-care. So it was hiking, going outside, meditation, mindfulness. They had journaling. We had a lot of different options. This current week, we're actually doing organizations making a difference. So we're touching on some of the organizations in the state of Georgia, as well as nationally, that are making great strides with suicide prevention, which we're really, really proud of. And for the following week that's coming up, we're going to do prevention through art, which we're really excited about. So if you are not already following us on any of our social media platforms, I would highly suggest you definitely log on. And we are V4PGA on all platforms. And once again, we'll be posting stuff daily. We have different activities. Yesterday, we just had a movie screening to celebrate World Suicide Prevention Day, where we showcased the S word, which was really great. And then next week, I know we're doing another film screening. So if you want any of this information, I definitely suggest to follow us on social media. You can also find all this information on our website, which is www.v4pga.org. And that is, I'll also be posting that. I'll also put it in the chat because I know we put it earlier, but I'll stick it in there again for us to, so you can look at it. But we're super excited about this month. Just on our social media platform. And outside of suicide prevention, we also do a lot of work with substance abuse. So we have daily, we try to post on weekly on substance abuse. And we do involve youth. We are actually working on getting youth more involved in our social media. So we're super excited about that. So some upcoming events we have, do you mind? There we go. Some upcoming events we have for this month, outside of our activities for Suicide Prevention Month. We have our V4P call, which will be scheduled September 17th at 2 p.m., which we're really excited about. If you are not already a member, please log in to our website and become a member so you can get the notification and register for that call. We also have an advocacy rally coming up on the 24th of September, which we're really excited about. This will be one of many rallies we will have throughout the remainder of 2020. And I know we're all kind of getting used to the virtual life, our new normal here. So we're excited to just bring something different with our rallies. So we're really excited about that. Also on September 29th, we have a suicide prevention clinician call, as well as a mental health trainer call. Both of those calls will be, the trainer's calls is at 2 p.m., I believe, and the mental health is at 10 a.m., if I'm not mistaken. But once again, those calls are open to members. So if you would like to participate, you can definitely log in and request. Another event that we have coming up is the release of our newsletter, which we're excited about. And I also want to touch on the toolkit that Dr. Gregg did speak about earlier, that he's composing for the Beginners Advocacy Toolkit for adults and youth. And V4P just released our toolkit for Suicide Prevention Month that has a lot of resources that we're super proud of and that you can find on our website as well. That www.v4pga.org. Once again, I'll put that in the chat when I'm finished speaking. But we have a lot of great resources coming out. So definitely keep an eye out for that. Next slide, please. For the month of October, we have the Bullying Prevention Month. So we're also going to be doing some activities regarding that month to bring awareness to bullying and various ways to promote prevention. And that is also what we're going to bring in the youth, which is highly important. As Shannon had spoke about earlier, the youth is kind of our future. So it's great to get their voices and let them make sure they're heard. So we're super excited about that as well. October 24th, it's October 21st, we're having a suicide prevention stakeholder call. October, it's also Red Ribbon Week in October that we will be celebrating and having various activities. In December, we have a suicide prevention clinician call, mental health call as well. And on December 16th, we have suicide prevention stakeholder call. So once again, throughout these months, we will be doing advocacy rallies, and advocacy rallies is going to be monthly. We're going to make sure that we show representation from all our regions, and we're working on bringing something new and innovative to you guys. So we're super excited. It's not going to be something you've already seen before. We're going to try to make sure it's engaging and new and fresh. So that is something that to look forward to if you don't already have it on your calendar. I hope that to see everyone there for those events. Next slide. And for all those who would like to obtain a prevention certificate for attending today, you can email me. My email is presented in the slide. It will be xellis@livedrugfree.org. And I'm going to let Dr. Gregg speak a little bit more about that.
Okay. Yes, those of you who know about PCCG, Prevention Credentialing Consortium of Georgia, know all about this. For those of you who might not know, this would relate to suicide and substance abuse prevention. It's an organization that's really worth finding out more about. And if you want to find out more about them, just email me. You can get certified in prevention. Some of you may already have the experience and education to begin the first level of certification. And we will mail those certificates out to you in the very near future as we get your request. But you do need to request one in order to receive a certificate. Want to say thank you so very much for being with us today. So many of you hung in with us the entire webinar, and we greatly appreciate that. Very much hope that I'll be able to see you as well as on the screen in the not too distant future, especially down at the Capitol. It would be great to see you there, especially in the hallways of the Senate and the House, educating our policymakers. So with that, hope you have a very wonderful weekend, and thank you so much again for all the incredibly important work you do.
And I did want to butt in just a little bit. I do apologize. I definitely want to give a brief shout out to another event that I completely forgot. That was my mistake. But we are having another event September 29th. That event is with the council, and let me pull it up here. Yes, we are with Dr. Norton. We're having a webinar that is September 29th, and it's going to be from 2 to 3:30 p.m. I think I'm going to ask Takoya if she could to place that registration in the chat for anyone who would love to sign up for that.
She did.
Because it's going to be a great webinar, and I do think everyone here would definitely take in the information. So I definitely want to kind of plug that a little bit.
Awesome. Great. Y'all go have a great weekend. See you later.
Bye-bye, everybody.
Bye-bye, everyone.